In today's rapid update video, we'll be going over a guideline side-by-side for hypertrophic cardiomyopathy, also known as HCM. This guideline side-by-side compares genetic testing recommendations for HCM from the National Society of Genetic Counselors, known as the NSGC, and the American Heart Association, known as the AHA, and American College of Cardiology, ACC, Joint Committee on Clinical Practice Guidelines that consists of the AHA, ACC, American Medical Society for Sports Medicine, Heart Rhythm Society, Pediatric and Congenital Electrophysiology Society, and the Society for Cardiovascular Magnetic Resonance. For the sake of this video, we will be using the titles of the NSGC and the AHA-ACC. The recommendations in this guideline side-by-side are divided into categories based on genetic testing, selection of genetic tests, family screening or cascade testing, and the risk of SED. In today's rapid update, we will just be going over some highlights, so to get the full side-by-side, make sure to check it out on guidelinescentral.com. Starting with genetic testing, both the NSGC and AHA-ACC recommend that genetic counseling should be offered to patients with HCM. The AHA-ACC recommends including a 3-generation family history as part of the initial assessment, while the NSGC recommends a 3 to 4-generation cardiology-focused family history be included as part of the genetic testing process. Both the NSGC and AHA-ACC recommend that postmortem testing can be beneficial and should be explored to help facilitate cascade genetic testing where appropriate. Now going into selection of genetic tests, the NSGC recommends that as a minimum, genetic testing should include genes with robust gene disease association for non-syndromic HCM, and inclusion of genes associated with syndromic forms of LVH may be valuable in some instances. In patients with an atypical clinical presentation of HCM or when another genetic condition is suspected to be the cause, the AHA-ACC recommends a workup including a genetic testing for HCM and other genetic causes of unexplained cardiac hypertrophy. For family screening or cascade testing, the NSGC states that family screening, including cardiac screening and cascade genetic testing as appropriate, should be offered to at-risk relatives. Cascade genetic testing should be offered in the setting of appropriate genetic counseling without limitation of age. The AHA-ACC states that in patients with HCM, genetic testing is beneficial to elucidate the genetic basis to facilitate the identification of family members at risk for developing HCM. The NSGC states pregnant individuals with HCM should receive specialized pregnancy care, including discussion of current cardiac medications. Regarding risk for HCM in future biological children, expectant couples should be offered preconception genetic counseling. The AHA-ACC also agrees and states that in affected families with HCM, preconception and prenatal reproductive and genetic counseling should be offered. In patients with HCM who have a variant of uncertain significance, also known as VUS, the AHA-ACC states the usefulness of clinical genetic testing of phenotype negative relatives for the purpose of variant reclassification is uncertain. The NSGC states that cascade genetic testing of at-risk relatives for a VUS is not recommended, as the presence or absence of the VUS does not provide informative or actionable information. As for risk of SED, the AHA-ACC states that in adult patients with HCM, the usefulness of genetic testing in the assessment of risk of SED is uncertain, while the NSGC did not address the topic. Both the NSGC and the AHA-ACC Joint Committee on Clinical Practice Guidelines agree on genetic testing and counseling for HCM. Some of those key recommendations include genetic testing and counseling should be performed by experts in genetics. Genetic testing should include the most common variants known to cause HCM. First-degree relatives of patients with HCM should receive genetic testing. Cascade genetic testing for familial variants, if helpful, in determining which family members need serial cardiac screening. Because what is known about genetics is constantly changing, variants should be reviewed over time for possible reclassification. And last, family planning is an important part of genetic counseling to help determine the risk of pregnancy and the risk of passing on HCM to potential offspring. There you have it. Make sure to check out the full guidelines side-by-side and other clinical tools at guidelinescentral.com.